We shall now break for tea and reassemble in another 10 minutes for the quiz.
Bangalore Medical College, Dr. Shalini and Kavya. Dr. Shalini and Kavya, are you here? Amala Medical College, Thrissur. Kindly pick the chits to determine which teams you will be seated in. So Shweta, give them the chits. There are chits on the table.
Medical College.
I'm Dr. Shalini from Bangalore Medical College.
Good evening, Dr. Anand from Amala Medical College, Thrissur.
Good evening, I'm Dr. Anjali from Amala Medical College, Thrissur.
Hello, I'm Dr. Samin from Calicut Medical College.
I'm Dr. Febin from Calicut Medical College.
Good evening, I'm Dr. Rupika from KMC Manipal.
Good evening all, Dr. Anu from Manipal.
So we start with the quiz now. So these are the general instructions. There will be 5 rounds. The rules regarding each round will be announced and explained prior to the round. In events of a conflict, the quizmaster's decision will be final. So we start with round 1. So here you have to guess the personality. So the instructions are as follows. Each direct question fetches you 10 points, which is 5 plus 5. 5 for guessing the personality and 5 for the contribution in the field of leprosy. Time limit is 30 seconds. No extra time for past questions. Past questions, if correct, fetches you 5 points. So round is clear. This is one example. You identify the personality and name the contribution to the field of leprosy. If you answer both parts correctly, you get 10 points. Otherwise, you get only 5. Okay? Team A is ready. So time starts 30 seconds for Team A now.
Is it Muir?
No. Question passes to Team B.
Muir.
No.
Roger?
No. So
Dr. Dharmendra?
Sorry?
Dr. Dharmendra?
No. So it's Dr. Sheskin, and his contribution was use of thalidomide to treat lepra reactions. Next direct question, so no team scores. Next direct question to Team B. 30 seconds.
Pass.
Dr. Dharmendra?
Correct. Name the contribution.
Dharmendra antigen?
Yes. So they get 5 points for the past question. Team C ready for the direct question?
Yes.
30 seconds start now.
Ernest Muir?
No. Passes to Team D. Passes to Team A.
Paul?
Complete the name.
I don't know the name. He was a Britishan born in India. I don't know the full name, it's just Paul.
That is quite non-specific. Next.
Paul Wilson Brandt.
Yes. And name the contribution.
Hand surgery.
Okay. So you get 5 points for the past question. Team B. Team B, ready for the direct question?
He should be.
So you've started the time for Team D, I hope. Okay. Yes?
Dr. Karshmer?
Sorry?
Dr. Karshmer?
No. Passes to Team A. Stores? No.
Dr. Rees?
No. So no one gets score for this round. So it is Dr. Jacinto Convitt, and contribution is vaccines in leprosy. So one general instructions to all team: when you have 30 seconds or 45 seconds, use all the time and give the answer at the end of that. Okay. So we proceed to round 2 now. So we called it clueless. So here each question we will be giving you 3 clues. The lesser number of clues you use to answer, the more points you get. Okay, I'll explain. So each direct question fetches you 20 points maximum. There will be 3 clues given. If you get the answer at the end of the first clue, you get 20 points. At the end of second clue, you get half the points, that is 10. At the end of third clue, you get 5 points. Time limit for asking all 3 clues is 60 seconds. So if you need clues, you should ask within that time limit. No extra time for past questions. Past questions 5 marks. So is it clear? So this round will start with Team B. So the first question is, you have to explain this deformity or this condition for which this splint is used. So take your time. If you are not sure, you ask for the second clue. You don't have to name the splint. You have to name the condition in which this splint is used. It's a deformity for which this splint is used. If you are not sure and running out of time, you can take the next clue.
Yeah, next clue.
So circumtibial and intraosseous route of transfer of tibialis posterior is one of the procedures used in a corrective surgery of this condition. Audience, please don't prompt. Do you want the third clue?
Yeah.
It results from the palsy of lateral popliteal nerve.
Full drop.
Okay, so you get 5 points. Team C, ready for the direct question?
Yes.
So scorers, 60 seconds. Start with the first clue. Identify this condition for which this procedure is used. It's a surgery and I will show you the picture now. You don't have to identify the surgery, you have to name the condition for which this particular surgery, which is depicted in the picture, is used.
Lag of thalamus.
Yes, correct. You get 20 points. So Team B, ready? So this is the picture which shows a procedure or exercise which is done in this deformity. So interphalangeal flexion is not possible when the metacarpophalangeal joint is extended in the picture number 1. However, when it is flexed, the interphalangeal joint will flex freely. You have to name this deformity in which this particular test or result is seen. If you are not sure, you can take the second clue.
Second clue.
So it occurs due to the contraction of the muscle belly of lumbricals interossei or due to fibrous contracture of the dorsal expansion.
Swan neck deformity.
Okay. So I'll give it to you. That was the third clue. I was looking for intrinsic plus deformity. So they got it for the second clue. So that is 10 points. Next, direct question to Team A. 60 seconds start now. So this is an instrument. It's goniometer, which is used to identify the angle or at which the joint is contracted to assess the range of movements, and it is used pre-operatively in this very common deformity. You have to name the deformity. Yes, correct. So they get 20 points. So Team A gets 20 points for their answer. So the answer is claw hand. So So now one question for the audience rounds. Meanwhile, the scorers can calculate the total score and let us know. So, International Leprosy Association was formed in which year? Anyone from the audience? Yes? Anybody else? If they come closer to that, I will give it to them. No? Okay, I'll give it to 1933. So it's 1931. Mifan can give the audience. Please let us know your name and the college. Okay. Sir, there are chocolates, more chocolates. So I request Dr. Shweta to announce the scores. So at the end of 2 rounds, we have both Team A and C leading at 20 points as a tie, Team D at 10 points and Team B not far behind.
We got 25 points.
For which round?
First round 5 points and
Okay.
next round 20 points.
1 second. Team C is 25, Team A is 20, Team B is 10 and Team D at 10 also. Is that correct? Okay. So we start with round 3. So round 3 starts with Team C. So this round will be dealing with certain histopathology or staining pictures. So again, each direct question fetches you 10 points. There will be 2 questions. If you get both correct, you will get 5 plus 5. If you get one correct, there will be only 5 points. Time limit is 30 seconds. No extra time for past questions. Past questions fetch you 5 points. Team C is ready?
Yes.
So identify this tissue reaction which will be displayed in the slide and give me the diagnosis. So you have to identify the tissue reaction and the diagnosis. Time starts now. 30 seconds.
Type 2 reaction.
Kindly explain.
EML. And
Yes.
Next question.
What is the tissue pattern which is shown in this picture, in the first picture? What can you see?
Forming macrophages with neutrophilic infiltration.
No. Question passes for 5 points.
Ma'am, forming macrophages are seen, and in that
No. I am looking at the comprehensive tissue pattern in the slide 1. Passes to Team A.
It's a resolving granuloma
So
with
the-
vermicene.
Next. To Team B.
Paniculitis.
Yes. So it's lobular paniculitis. You get 5 points for half the pass. And 5 points for the direct half answer to Team C. So 5 points to Team C, 5 points to Team B. Team D. Identify and name the pattern of arrangements of the cells which will be shown in the next picture. And what are these spindle-shaped cells made up of?
Ma'am, pattern is histoid habitus.
Yes.
And the cells are derived from histiocytes, fibroblast cells. They derive
I want the exact lineage of these cells. What are they?
when they're spindle-shaped cells,
Yeah,
in
spindle
which
shape. What are they?
they're histoid leprosy cells, ma'am.
What are they made up of? No. Next.
Epithelioid cells.
No. These exact lineage I need. They come from where? It's mentioned in the book.
Macrophage,
Yes, they are macrophage histocytes. What is the exact lineage that is mentioned?
monocyte,
Okay. Next.
histoid habitus.
No, that is the histoid habitus. That part they have answered. It's histoid leprosy. They answered the story form pattern. You need.
Tuberculoid content.
No. So we were looking at dermal dendritic cells, the exact lineage from where they have come. Okay. Next, Team A. Identify the. Sorry, sir. So 5 points to the team for answering half the question correct. Identify the structure pointed by the arrow. and name the special stain which is used here. So the arrow points to a structure in brown and name the special stain used here.
Lepra bacilli.
No, incorrect. Passes to team B. Identify the structure pointed and name the stain which is used in this particular picture.
No.
Passes?
No.
Yes?
No.
Complete the answer.
No bundle.
No, what is the stain used here?
Stain.
Passes?
Bodian stain? No, but
No.
S100 stain,
Yes.
Schwann cells.
So we will share 2.5 points. Since you gave half the answer. So just to clarify, previously team B got 5 points for the previous question. Then now team B 2.5 and team D 2.5. Next question. Team B, identify the stain which is used here. The stain does not have anything to do with the second question. What is the principle of Fite's modification of Ziehl-Neelsen stain? This is a picture. This is a stain you have to identify. And the second question is, what is the rationale behind Fite's modification? If you don't know the first one, you can attempt the second one. Just 30 seconds, time is running out. Yes? Passes?
It's a job charcoal modification of Fite varicose.
You are answering for the first half?
Yes.
No. Answer the second one.
The hematoxylin is used instead of carbol fusion.
No.
Ma'am, the principle was that Fite varicose induces artificial acid fastness. So arachis oil was introduced in that, and job charcoal modification was that
We don't need job charcoal modification.
arachis oil induces
What
acid
does this
fastness.
oil cause exactly? What is the principle behind using this oil? It's not exactly oil xylene.
Xylene
What is
peanut
the
oil.
exact-
It induces artificial acid fastness. So the bacteria which are not visible on normal Zn staining.
How does it induce? I want the mechanism. Why is it used? Do you know what stain this is? Okay. I'll pass. If I get a better answer, I will take that. Otherwise, I'll give you 2.5. Team A.
Is it Lexol fast blue stain?
Sorry?
Lexol fast blue stain?
No. Can you answer the second half? What is the rationale behind using the... Why do we use oil xylene? What is the principle of use of oil xylene? Okay. So it's colloidal ion. It stains hyaluronic acid present in the globi. That was the blue material which was seen inside. And oil xylene is used during deparaffinization to dissolve the lipid layer to make M. leprae more prominent. But since she told something to do with addition of the arachis oil, I'll give her 2.5. So this is team D. So kindly assimilate the scores. This is the audience question. Please identify the stain. These are none of the previously used stains. So anybody in the audience? Oh. So we'll give you more chocolates if you answer this. So here the monoclonal antibody is used against the BCG. This is the anti-BCG stain, which is sometimes used to identify doubtful cases where we can identify the M. leprae by using these stains. You can identify the brown particles. Incidentally, this is a picture taken from a treated case of lepromatous leprosy post-treatment to still show dead bacilli which are present. Coming to round 4, so this is a mixed bag. Different types of questions will be addressed or given to different teams. We have to start this round from team B. Each direct question again 10 points, time limit 30 seconds, no extra time for past questions, past question 5 points. Name the splint and its use.
Finger loop splint.
Yes?
It's used in cases of claw hand.
Yes. So 10 points. Team A, what is FDA EB staining? Expand. What is the color taken up by live M. leprae in this stain?
So fluorescent diamine ethionamide bromide staining.
No. Somewhere close. Okay, do you want to answer the next one? Do you want to modify the stain?
Ethidium bromide.
Yes. What is the color taken up by live Mycobacterium leprae? So second half passes to team B.
Fluorescent green.
Yes. So team B gets 5 points, team A gets 5 points. So it's fluorescent diacetate ethidium bromide, okay, not diacimine, and it's green. So diagnose and describe this particular histopathological feature you're observing in this picture. So this is to team B.
Granuloma.
No, identify this particular pattern. It is a specific pattern, that is why I put this picture. And diagnose, make the diagnosis based on this particular feature which is seen here. Passes. Team C.
Epithelioid contamination.
No. Passes to team D.
It's an onion cut appearance.
Yes.
It shows the perimural thickening.
Correct.
It can be seen in BL and LL.
Yes. So they get 5 points. So this is the typical onion peel appearance due to the perimural infiltration, and it's borderline lepromatous leprosy. So ma'am, Dr. V.P. Shetty ma'am had shown some pictures where there was complete destruction of the nerve in the tuberculoid end, while there was only perimural infiltration in the lepromatous end, especially the borderline. So team C, where was ICRC vaccine developed and what is it composed of?
It
Team
was
C. Yes?
developed in Indian Cancer Research Institute,
Yes.
Mumbai.
Yes?
The main component is PP1 of
Yes? Of? I want to know the mycobacterial strain which is used here.
Mycobacterium vaccae.
Sorry? Please be more clear.
Mycobacterium.
Yes, it is a mycobacterium.
Mycobacterium vaccae.
No.
Welshi. Sorry, Welshi.
You cannot go on guessing. So passes to team D for the second half. What is it composed of?
Ma'am, Mycobacterium welchii.
No. Team A?
Mycobacterium W.
That is Welshi. No. Team B?
CME.
Sorry?
CME.
No. So 5 points for this round for team C for the direct question. So it was developed in Cancer Research Institution, Mumbai, and it's a strain of Mycobacterium